I've been in practice now since 1980, so over 30 years. Probably for the first close to 20 years we had our own practice, starting with 2 doctors and eventually getting up to 7 doctors. And then after we were no longer in private practice, I worked for another group in town for 6 years, and then I came to Health East 10 years ago, and I've stayed ever since. The current chief medical officer for Health East, Dr. Kohler, and I went to medical school together. And he and I have been friends for 30 years, and we always sort of talked about practicing together, and we never could make it work. But he called me one day and said, let's go out to breakfast. And when Steve calls, you go out to breakfast. So he caught me at a time when I was kind of susceptible to the pitch, and it was Steve, maybe more than Health East itself, that attracted me to Health East. And what I've learned since is that there's a lot to attract one to Health East. Their heart's in the right place, and you know, nothing's perfect in life. It wasn't perfect when I was in private practice. It wasn't perfect when I was at the other group, certainly. But they try to do the right things, and that is still the case, and I think that's reassuring. I came in as an endocrinologist and kind of a diabetes specialist, and I've gotten all the support that they said they would give me 10 years ago. And Health East has found a way to always fund what we want to do, even though what we do doesn't necessarily bring in big money. They've given me enough rope to do what I want to do, and have supported me. Now, I've had to do things to sell myself too, but they have followed through on what they said they would do. So from a selfish point of view, the right thing is to do what you promised to do, and they've done it. On a macro point of view, there's no for-profit hospitals in Minnesota. It's owned by the community. So they're involved in the community. They're trying to do what's right for the community, use the resources appropriately for the community, even sometimes when they have to pay for it themselves. But they're community-oriented. So that's what I mean, trying to do the right thing.